It's a pleasure to be with you. The title of this talk is Public Health in Housing. There are no disclosures for this presentation. Objectives include define health, discuss the importance of adequate housing for community engagement, understand that investment in resource-poor communities improves health, understand the impacts of poor housing on health, and understand the potential roles for public health in housing issues. What is health? That's an essential question to answer. It helps define goal parameters and metrics used for measuring success. The definition of health also informs the role of public health in housing. Does housing really matter in health? As a practicing pediatric infectious disease specialist, like other physicians, I was primarily trained to identify, cure, and mitigate diseases. Even though never given a definition of health in medical school, during my residency or fellowship, I came to understand that health was essentially the absence of disease. But is that true? It didn't take long in practice before I realized that the absence of disease was only part of the true definition of health. Many patients and families that I cared for were physically well, with no physical disease I could identify by examination or laboratory data, but they weren't happy or experiencing fulfilling lives. They weren't psychotic or excessively depressed or anxious, but they were miserable. Definitely not a healthy situation. It didn't fit a medical diagnostic category, but I knew something was not right. So true health is more than just absence of physical disease. My wife and I spent 12 years in Africa, 4 years in Zaire, now known as the Democratic Republic of Congo, and then 8 years in East Africa. In Zaire, Diana was a bush pilot, transporting patients from our outlying 200 dispensaries and clinics throughout the Ituri rainforest along the Congo River to our relatively primitive tertiary care hospital at Nyankundi. I was one of 3 physicians in that 350-bed hospital covering pediatric and infectious disease patients. We learned a lot from our African experience, a different perspective on the term health. Africans define health as harmony. Harmony in 4 areas: harmony with self, harmony with others, the environment, and harmony with the supernatural or spiritual. In this context, health was not associated with absence of disease at all. A person could have terminal cancer, yet if in harmony in those 4 areas, was considered healthy. There were many patients with terminal diseases that I couldn't cure or control, children and adults, who died, but were in harmony to their last breath. It's not that control of diseases was irrelevant, but the harmony perspective added another important dimension to my personal understanding of health. This dimension of seeking harmony applies to palliative medicine in the United States, providing the terminally ill with as much harmony as possible. Everyone wants to be disease-free, but that's not reality. We all will eventually die of something. In situations we can't change, it's reasonable to seek things we can control: contentment and harmony. Having said that, we need to avoid the paralysis of fatalism. Fatalism says nothing can change. Current conditions will continue as they are. It's ordained by God. We can't do anything to improve the situation. Many things can change, must change, be adjusted, and refined to improve life. We need to be proactive, change what we can. This conference on housing is all about what can be changed regarding housing to improve the lives of people in this state and nation. Back to our definition of health. Health and wellness is more than absence of disease. True health and wellness covers all aspects of human life, all the determinants of health, including the physical, social, spiritual, emotional, and economic well-being of individuals. All individuals are members of communities. An engaged community, a major goal of the Governor's Main Street Initiative, addresses all these determinants of health to improve the well-being of all community members. To dissect this a bit further, physical health doesn't just relate to disease processes, but also the built environment as listed on this slide that includes housing and homes, the condition of neighborhoods, adequacy of and access to transportation, the viability of community businesses, and adequate schools. Other key factors that impact physical health includes the natural environment, like the weather or location near a river, exposures and physical hazards, physical barriers, including those for persons with disabilities, and aesthetic elements, such as good lighting, trees or benches, etc. Another concept that underlines the importance of housing and health relates to Maslow's pyramid. Healthy people and communities are interested in growth, improvement, and resilience. As a pediatrician, I monitor the growth of my patients. If a child isn't growing, he or she likely has a major organ problem, and if not appropriately addressed, will die. The same is true for other individuals and communities. At the top of Maslow's pyramid is the area of growth, improvement, and resilience, also called self-actualization. This is the area where people and communities manifest the attributes of creativity, flexibility, and adaptability. This is where communities and individuals capitalize on the unique abilities of members, search for meaning, plan for the future, and develop community capacity. Growth needs or self-actualization primarily come into focus when the lower deficiency needs are mainly satisfied. Housing is a basic need and related to all the lower levels or strata of the pyramid and include esteem, belonging, safety and security, physiologic needs, including physical structural needs of having a place to stay. People in North Dakota, the United States, and around the world need good housing. They need their basic needs met. When those basic needs are met, they can then refocus their time and energy on self-actualization, growth, and creativity. They then become healthy, engaged communities with healthy, engaged members. There are three major sets of tools to change risky behaviors: policy, influencing an individual one-on-one, the clinical, and population-based interventions. Policy, developed by local, state, and federal governments, businesses, and organizations, is an effective tool to encourage healthy behaviors, but must be implemented and enforced to be effective. Clinicians are trained in one-on-one counseling, another powerful strategy to change risky behaviors. Population-based interventions provided by public health is another potent impact on behaviors and can be divided into two tool subsets: social marketing and community engagement. Housing improvement relates to policy development by governments, business, and organizations. That policy needs to be supported and implemented by communities that are engaged by public health to own their problems and solutions. Increased investments, especially in low-resource communities, has been associated with decreased mortality from preventable causes of death, including those associated with infant mortality rates and deaths due to cardiovascular disease, diabetes, and cancer. For each 10% increase in local public health spending, including that for housing, mortality rates fell between 1.1 and 6.9%. Poor housing is associated with several health-related problems, including infectious diseases associated with issues like insect and rat infestation. Rat infestation is associated with several contagious infectious diseases like hantavirus, murine typhus, rat bite fever, salmonella, leptospirosis, and eosinophilic meningitis. Flies associated with salmonella and various causes of diarrhea and conjunctivitis. Cockroaches with gastrointestinal diseases caused by salmonella, protozoa, and viruses, and crowding with tuberculosis and respiratory infections. Poor housing is also associated with chronic diseases, including asthma with damp, cold, and moldy environments, cardiovascular disease associated with large deviations of indoor temperatures, especially for the elderly, toxic substances associated with poor ventilation, including volatile organic substances from particle boards and floor coverings, carbon monoxide from substandard heating systems, asbestos and radon causing cancer, and lead associated with old paint, lead pipes, and deteriorating plastic blinds. Lead intoxication causes developmental problems for children and aggressive behavior and high blood pressure in adults. Poor housing is also associated with injuries from burns and falls. Poor housing is linked to childhood development and nutrition problems, often caused by unaffordable housing for poor families forced to choose to pay rent over adequate food. It's also associated with mental health issues due to excess temperature that causes increased irritability and social intolerance, damp, mold, and cold associated with increased anxiety and depression, crowding and fear of homelessness with psychologic distress, temporary housing with childhood behavioral problems, substandard housing with social isolation, and excessive noise with sleep deprivation. Neighborhood effects associated with poor housing include low socioeconomic status linked to poor birth outcomes, cardiovascular disease, HIV, gonorrhea, and tuberculosis transmission, depression, decreased physical activity, and general mortality, and less collective efficacy associated with lower levels of trust, social cohesion in forming social control, and increased violence. This slide lists the potential role of public health in housing issues and includes assisting in the community assessment process to ascertain community needs and resources, providing public health services for the homeless in collaboration with social service programs, providing public, legislative, and workforce education on the importance of housing related to health, help develop and enforce housing policies, facilitate community engagement, and facilitate collaborations on things like policy development and housing services. Public health is well positioned to bring together collaborative partners. Someone needs to take responsibility and leadership on collaborative efforts. This likely is a key role for public health, locally and at the state level. In summary, health is more than absence of disease, but includes the physical, social, spiritual, emotional, and economic well-being of individuals. Adequate housing is a basic need of human beings. Housing improvement relates to policy. Poor housing is linked to several health and wellness issues. Public health is well positioned to facilitate collaborative partners to address adequate housing issues.